Hi everybody, I'm Amy Curtis. I'm the science librarian and was in your class earlier in the year. And I'm just doing quick little videos to help you go over what I would have taught you in library instruction this past week. And hopefully with the short videos, you can pause when you need to. Please email me if you have additional questions or need assistance, and I'll go over how to do that too. But I'm going to go through the PowerPoint pretty quickly to make this short, and then do separate screencasts with demonstration of library resources and free online resources that'll be helpful for upcoming projects in this class in particular. So we're talking about evidence-based interventions, what it means to be evidence-based. So those are going to be practices or programs that have been peer-reviewed, documented empirical evidence of effectiveness. So they're not theoretical. You want to be looking for the convergence of the best research evidence, practitioner expertise, what's up to date, and what is that particular population and its values. So when you're looking at evidence-based interventions, they're important because they aim to provide the most effective care available with the aim of improving patient outcomes. Patients expect to receive the most effective care based on the best available evidence. So as you're looking for these interventions related to your topics, you can think about what did this particular population or study do that was effective, and how can I translate it into helping my particular population and their values? Or maybe what wasn't effective and what you would change. So this is the evidence pyramid. This is just a tool to help you visualize quality of evidence and the amount of evidence available. So as you go up the pyramid, that's going to be the highest level of credibility, highest level of evidence is the meta-analyses and systematic reviews. The ones on the bottom are going to not have quite the level of vigor. They're still good, definitely. But just to be aware of these different terms, and you can pause and maybe jot them down, just because with PubMed, at least, when you're searching for interventions, you do need to know these terms a little bit. So don't stress about it, but I just want you to be aware that these are different types of studies that are available. Okay. So if my health inequity were breast cancer death rates in African American women, the first thing you want to make sure is that your health inequity is something that actually exists and you can find data to prove this. You want to think about what others have already tried, what works for this population, also what maybe didn't work for this population and what you would do differently to adapt those different studies. Okay, maybe pause for a minute on this screen. So the options to the left here are going to be different library databases. I'm going to show you how to use PubMed, which may be a review for some of you, but it's good to go over the basics if you need it. These other databases you're welcome to use as well. To the left, the ones to the right are free online resources. So I will go over the Community Guide and Healthy People 2020 briefly. They do work differently than typical databases, but these are credible free sources. I'll show you how to get there. They will work well for most of your topics, at least the Community Guide, maybe not Healthy People 2020, it just depends. Our tips is going to be anything related to cancer. So if your topic has to do with cancer inequities, maybe that's the place you're interested in. SAMHSA is going to be substance abuse and mental health. So again, if that applies to you, that's something that you want to look at. If not, don't worry about it. And Debbie, which is the CDC resource, is going to be with anything to do with HIV. Okay, so just kind of a basic overview of searching in databases. You don't want to write out a whole sentence or phrase. You're going to think about keywords related to your topic. So if I'm pretending that my topic is inequities with African Americans and breast cancer and death rates, for example, I would make a column for my population and other ways to say that term. So may or may not be synonyms, as you can see here, but any different ways that you can refer to that thing. If you were doing drug abuse, for example, you might do substance abuse, drug abuse, also naming particular drugs. Um, so try to think of it in different contexts. As you start your research, you're going to see additional author supplied keywords. So I would tell you to please keep a running list of what you've searched, um, because even if you think you'll remember, you may not, and it's hard to duplicate those results. And start simple when you're searching with maybe one or two keywords related to everything that you want to find out. But you can always add those additional terms here. The most important thing to remember is use the ors only with things in that same column. So with my example, I have my population and I'm using parentheses to search African American or African Americans or blacks or people of color. So that's expanding my search to include articles that have any of those terms or all of those terms. We're looking for all of those things. You want it in a parentheses because kind of like a math equation, we just want to keep those all together to expand your search. Only use ors down that same column though. I would never search African American or breast cancer because that's not going to give you the results that you want. I also have quotation marks around people of color because I'm searching for that phrase in entirety. So this is a helpful tool for maybe 3 words or so if you have a exact phrase that you want to search for. But just be careful how you use that because if it's worded slightly differently, the database won't predict what you're trying to find, like something like Google would. So just be aware of how you're using that tool. So with my example, I have the topic here with different synonyms. So maybe you don't know different ways to search for your topic yet. I'll show you this when I show you PubMed. But there may be either more scientific jargony ways to say what you're looking for or more general and specific terms too. So you can see here, maybe I didn't initially know that breast neoplasm is another way to say breast cancer, but you will encounter these additional keywords as you start searching and you look for the ways these articles are categorized in the resources. So intervention too. Um, these are all different suggestions for ways to search. You can also add additional columns and topics. So don't feel tied to only searching with 3 different things, if that makes sense. For intervention though, you could do intervention or treatment or inequity or disparity. Um, so these are all things that are maybe not necessarily synonyms, but they're different ways to say that same topic that you're looking for. Okay, so maybe pause for a second and just jot down different keywords that you can relate to your topic and your population and intervention. So take a minute to pause and brainstorm. I would tell you to do a physical list on a piece of paper or type it up in a Google document, just however you best keep track of things and organize when you study. It's a good idea to just keep a running list of what you've thought of, and you can always add to it or change. Okay. Sorry about that. I skipped through all the interactive parts because I'm going to do a separate screencast where I demonstrate some of these resources for you. But I do want to share my direct email if you have questions related to this or any other library things. I can at least direct you in the right way. And since this video is almost finished, I just wanted to touch again really quickly. If you go to the main library homepage, library.ecu.edu, and then scroll down here, you can click on View Research Guides, and there is the research guide for this class. There's a specific one for this course number. These are research guides created by librarians with helpful links and tips for you guys. Probably your other classes have one too. So you're going to click on Health and Human Performance, Health 3020. This is just a good place to go back if you're confused and you want additional help finding these different links and resources that I'm going to show you how to find. But if you do forget, it's a good place to at least start looking for information. Evidence-based interventions here. This is going to go over that evidence pyramid I briefly talked about. There's also these different free online resources. So you should be able to use these links here. I'm going to go over in my other video other ways you can find them, but they're all credible free online resources, and that's where they live. If you want to email me directly, you can do so here. These are all linked to our joiner reference desk. So since we're going all digital at the moment, our hours are slightly different, but we are monitoring the chat and the email and the phone. And we will get back to you as soon as we can. I wanted to touch again on the Book a Librarian service because we are still offering that. So while we're not doing in-person consultations, you could do telephone, online WebEx, or email options. So that's basically just me or another librarian dedicating 30 minutes of time with you to help you with research. And you're able to do that for any of your classes at any point, and we're happy to assist you however we can. And while I'm here really quick too, let me go back to the main library homepage just to finish this. Sorry. Okay. Library.ecu.edu. The other way that you can contact just the reference desk in general is the Ask a Librarian link right here. And that will give you similar options. So any of these you're welcome to do too.